Lengkapinya untuk semua transaksi. Kamu juga bisa.
Halo, selamat siang, salam sehat selalu. Terima kasih Anda masih bersama kami di acara IDE Katadata 2021. Dalam rangka menuju ulang tahun Katadata ke-9, Katadata mempersembahkan Indonesia Data and Economic Conference atau IDE Katadata 2021 dengan tema besar Reimagining the Future of Indonesia bersama saya, Maria Margareta. IDE Katadata merupakan event tahunan Katadata yang menyuguhkan beragam diskusi inspiratif seputar data dan ekonomi secara virtual, yang digelar dari tanggal 22 Maret hingga 25 Maret 2021. Acara ini disponsori oleh East Ventures, Bank DBS Indonesia, PT Barito Pacific Tbk, PT PLN Persero, Unilever Indonesia, GIZ, German International Cooperation, Link Aja, dan didukung oleh GoPlay, Oxford Business Group, serta para media partner, Media Group, Metro TV, Media Indonesia, Medcom.id, dailysocial.id, Berita 1, Tech in Asia, Kompas.com, dan juga NET. Dan eksklusif di hari pertama ini merupakan kolaborasi antara IDE Katadata 2021 dengan DBS Asian Insight Conference 2021. Oleh sebab itu, tayangan ini dapat juga Anda saksikan melalui kanal YouTube Katadata Indonesia, Facebook Katadata Indonesia, YouTube DBS Indonesia, Zoom Webinar Katadata Indonesia, Instagram Katadata.co.id, dan kunjungi website katadata.co.id serta goplay.co.id. Diskusi ini juga berlangsung secara bilingual, jadi silakan bagi Anda yang ingin mendengarkan dalam bahasa Inggris untuk mengaktifkan fitur interpretation di aplikasi Zoom Anda, lalu pilih atau klik English. Di sesi ketiga kali ini kita memiliki tema diskusi How to defeat COVID-19, invest in public health, and go on the offense. Bersama pembicara Dr. Yong selaku health expert and President of the World Bank Group periode 2012 hingga 2019. Langsung saja kita saksikan jalannya diskusi yang akan dipandu oleh expert panel Katadata Insight Center, Gundy Cahyadi.
Welcome everyone, and we are very privileged to have with us Dr. Yong. Dr. Kim is obviously a globally well-known health expert and has had a long distinguished career in public service. Most recently, he served as the president of the World Bank from 2012 until 2019. Dr. Kim, delighted to have you here and glad to see that you are doing well over there.
Dodi, thanks for having me on. It's great to be with you, and it gives me another chance to wear my Indonesian batik. So it's wonderful to be able to at least virtually be with all of you in Indonesia.
Thank you so much, Dr. Kim. Now let us just begin this session. And my first question, really, I'm just going to shoot directly at you. Is Dr. Kim, at which stage are we at currently in the fight against COVID-19? If you could give us your opinion on this question.
Well, I think unfortunately it's still unclear where we are. There are some fantastic news, and I would say that the best news that coming out of the fight against COVID has been the development of the vaccines. You know, I said probably 9 months ago, 10 months ago, that it would take at least a year. And so it's taken about a year, which is just extraordinary. So the fact that we have these vaccines And the fact that we have these powerful new mRNA vaccines, which can be adjusted. I mean, the variant strains can be attacked directly by just simply changing the slice of mRNA that's inside the vaccine. I mean, these are tools that we've never had before, such powerful tools. So that's the good news. I think the bad news is that except for a few countries, mostly in Australasia, the world has not responded effectively to COVID-19. And I think it's entirely predictable that the cases are going up and down as they are. Indonesia had its peak in January, and the cases are going down. But all you need to do in terms of trying to understand what the future may look like is look at Italy. Italy, of course, had the first major problem with COVID, with the very high hospitalization rates and death rates. They're back on lockdown. And the part of it is that the vaccine rollout is not happening quickly enough. But the other part of it is that they just took too many liberties with the usual careful practices that they had been engaging in for a year. They went out, there was a lot of gatherings, large gatherings, and now they're back in lockdown. This is a very serious virus. And the countries that have taken it seriously from day one, countries like China, South Korea, New Zealand, Australia, the countries that have taken it seriously from day one are now almost back to normal. And the vaccine will prove to be an extremely powerful tool for them if they use it strategically to maintain the level of disease that they have right now, which is just almost none. Every country in the world has to get to where those countries are to really shut down the pandemic. You can't just try to vaccinate people and think that the virus will go away. You have to have a combination of very aggressive, focused, strategic vaccine efforts, and also the full public health response that has been so far the only thing that's worked to bring coronavirus under control, the COVID-19 under control. Nothing else has brought COVID-19 under control, not even very high vaccination rates that we're seeing in, say, in parts of Israel. Even as we get up into the higher rates of vaccination, without the accompanying public health response, COVID has not been brought under control.
Dr. Kim, you have been at the forefront of fighting various pandemics, HIV/AIDS, Ebola in Africa, cholera, and so on. Can you walk us through, what are some of the necessary steps that are needed for us to really get out of such a pandemic? Will we ever get out of COVID-19? That's where I'm coming from.
So if you think about all the different pandemics that have affected the world, we've learned that there is a very standard approach that you have to follow if you want to bring them under control. The first is you have to be able to test. You have to know whether somebody is infected or not. Second is that once you know whether somebody's infected or not, you have to do contact tracing. This goes all the way back to smallpox. In the poorest areas of India, in Bihar state, the poorest state in India, without telephones, without electricity, they were able to eradicate smallpox because they did aggressive contact tracing. Right. The third step, once you've done the contact tracing and know who was infected and who they were in touch with, you isolate, that's the correct technical word, you isolate those who are known to be positive, and then you quarantine those who've had contact with that person who is positive. And those circles of quarantine have to extend out as far as you need in order to stop the spread of the virus. Isolation and quarantine. Now, the other elements, of course, are you've got to be able to treat those who are ill if you have the means. And in this case, we now have much more effective drugs than we had in the beginning of COVID. So if you did all of those steps, if you did testing, contact tracing, isolation and quarantine, treatment, if you do all those things at the same time, then you really can get the virus under control. And we've shown this again and again. It was what we had to do with Ebola, and the strategies worked very well. We now have a vaccine for Ebola, and they used the Ebola vaccine very strategically over the past few years. There's unfortunately another outbreak happening right now in Guinea, but again, with the contact tracing, with the testing, with the strategic use of the vaccine, I think people think they can get that under control. What happened with COVID is it hit us so quickly, and it had characteristics that were so dangerous that it just spread much more quickly than previous versions of this virus. So for example, SARS, the original coronavirus infection, had very different characteristics. It just did not spread as quickly. And people were not infecting others until well after they developed symptoms. So you knew, you had a high suspicion that someone with symptoms might have SARS. You were able to test them and isolate them before they were infectious. The thing that's so dangerous about COVID-19 is that even before anyone has symptoms, 4 or 5 days before anyone has symptoms, they can infect others. So with this particular virus, it's extremely important to be very, very aggressive with your testing, with your contact tracing, isolation, and quarantine. Again, the places that have done that well have gotten it under control. What happened in the United States, even the country that was supposed to be the most prepared for COVID-19, even public health officials were saying, it's too late, we can't do that, we just have to wait until we reach herd immunity, right? Now, that was so unfortunate, right? Because the notion that we would reach herd immunity, meaning there would be enough people who are infected, or there would be enough people who are infected, and then in addition, we vaccinate people, that the virus would burn out. That was just, we've heard that with so many different vaccination and eradication efforts. A very good friend and mentor of mine was the person who came up with a strategy for eradicating smallpox. And what he told me a few weeks ago was that during the smallpox eradication campaign, he kept hearing again and again from his own team that once they get to 70 to 80% vaccination, they'll reach herd immunity and the virus will go away. And it never did. It never worked like that for smallpox. Everyone was hoping that it would work like that for smallpox, but it did not. And so the concern now is that this will not work for coronavirus either. We will have to not only get to as high a level of vaccination as possible, but we're also going to have to implement the public health response. Now, there are ways to do this public health response that could be very effective and also very effective in Indonesia. And I'll talk about that if you'd like.
Talking about the public health response is going to be one topic that I'm going to touch later on. But let me get back to this idea about vaccine distribution. I think one of the issues that the pandemic has really stressed on the world is this inequality between the rich and emerging economies. And I think it's very interesting to me when we hear news about some countries having over-ordered vaccines up to multiple times of what is needed to vaccine their population, whereas countries like Indonesia, India perhaps also have very little in terms of proportion of vaccine that is needed to vaccinate their population. Has the pandemic, Dr. Kim, really made income inequality worse globally, and what can we do about it going forward?
I think there's no question that more people have been plunged into poverty. I think I've heard that over 100 million people now have been plunged into extreme poverty as a result of the pandemic. I think there's no question that inequality has gotten worse in general. But again, I think that all countries that are part of the Chinese value chain, they're doing relatively better because China's economy is almost completely back online. And they're almost completely back online because they implemented such aggressive public health measures. I mean, China really did it correctly. And you can argue with some aspects of what they did. Did they notify the world soon enough? There are some questions and those are being explored right now by the World Health Organization. But overall, they stopped the outbreak in Wuhan. And now, the number of community transmissions in China is close to zero for a very, very long time. And so those countries in the Chinese value chain, I think, will do relatively better. Let's get to the vaccine issue, though. So in the OECD countries, they have ordered enough vaccine for 175% of their population. Whereas in the developing world as a whole, they have ordered about 25%. And so already in Africa, for example, we're looking mostly at orders for 2022. I mean, the vaccine for 2021 has already been completely accounted for. And so what will the countries that have ordered so much vaccine, will they start distributing those vaccines to developing countries? This is an open question. I'm not sure. I think that there are a lot of very interesting efforts going on right now to see if we can establish production capacity in developing countries. Moderna, for example, who's just been on the cutting edge of technology, has said that it will not enforce its patent during the pandemic. So, it's not going to be easy to make the Moderna style vaccine, but I think it's going to be possible. And so I think we have to look at creative solutions of, potentially, for example, creating vaccine production capacity in Africa, in Southeast Asia, maybe even in Indonesia. I think those things are possible. Now, the reason I think it's important to start looking at that kind of capacity is because I don't think this is going to go away anytime soon. And Moderna has done such interesting work. They've modeled every single potential mutation of the coronavirus. And so they would be ready to create new versions of its vaccine very quickly. And because it's already been approved in its current form, if all you're doing is taking one piece of mRNA and replacing it with another, or even adding an additional piece of mRNA, if that's all you're doing, then it's likely that it won't have to go through all the stages of clinical trials. And you can just simply do some efficacy tests and then go right to the market. I think this is what we're going to need. I think we're going to need continuous updating of vaccines. And part of the issue is that some of the vaccines that are out, and I was mentioning Johnson & Johnson being one of them, you can only give it once, because the vector that it carries the RNA in on also creates antibodies. So once you've given it, you can't give it again, because you would be risking a very serious reaction to the vector on which you're sending in the RNA. So I think that we have to really think about what's the strategy to get really these new vaccines that can be given over and over and over again. What's the strategy of getting the production of those vaccines going in every part of the world? I hope that there will be enough vaccine out there so that we can have a combination of much more aggressive public health strategy with widely available vaccines, so that, for example, people can go to Bali. I know that there's a discussion in Indonesia right now about whether you want to focus your vaccination efforts on industries that are critical, and then have some kind of vaccine passport. I think that's possible. I think that could be done. The one thing I would say is that right now the vaccination efforts have not been strategic enough. So I'm working with a few of my colleagues, including Bill Foege, the person who really was the mastermind behind smallpox eradication, to come up with strategies for developing countries in which they can be much more strategic in how they vaccinate people. If you just do it based on demographics, well, if you're of a certain age, or if you're in the United States, it's if you're a certain age. If you're in a nursing home, you can get the vaccine. And so what's happening is we're already seeing inequality in access to vaccinations in the United States. Whereas if you took a different approach and said, okay, what we're going to do is use vaccines. We're not going to focus so much on age. We're going to let those who are over 65 or over 75 who are at high risk. Of course, we're going to let them get the vaccine, but then after that, we're going to focus our efforts on the places where the virus seems to be spreading, and go specifically at those places. and vaccinate around those particular places as widely as possible, and really give it to everybody in the area. Not to children, because we don't have data on children yet, but on the safety of vaccination on children yet. But do that in a much more strategic way. If you did that, then I think the vaccines would have a much more powerful impact on getting back to work.
Well, thank you. That was great. Dr. Kim, going back to this, going on an offense in the public health front, I mean, you touched some aspects of this for developing country, especially on the vaccine side. Could you provide more detail? You mentioned about what are the necessary steps to go on an offense. How can we try to learn from the best example that has been implemented in countries like China, South Korea, Australia, like you mentioned?
Yeah. So, first of all, and unfortunately, it's still an issue, but you have to have enough testing, and testing is getting better. So it used to be very difficult to get a test for COVID-19, but now they're much more widely available. And I think you're also seeing home testing expanding. And so you really need to be able to test broadly. Contact tracing is very labor intensive. And even if you don't feel that you're going to be able to do all the contact tracing now because there's just too many cases, you're going to have to get there eventually. I think there are still over 5,000 cases a day in Indonesia. So it might be difficult to do full contact tracing, but you have to think about not today can I do contact tracing, but as we get toward the end of the pandemic, I'm going to need to do contact tracing. So I better start building the system now, because what's going to happen is the virus could potentially continue to outrun our ability to make new vaccines. So there'll always be little outbreaks, and you're going to have to be able to chase down those outbreaks. Isolate and quarantine the people who are at risk. Use the vaccines on the people who are around those people. Treat the ones who are sick. You're going to still have to do all those things, and so there's no way to do that other than with people. And you have to have people who know the local communities. You have to have people who are relatively trusted in the local communities, because you're asking difficult questions. And what we found in Massachusetts, the state that we've been helping, is that there's a really strong possibility that the same people who've been doing contact tracing can also participate in vaccine distribution. So, for example, there are a lot of people who are worried and don't want to get the vaccine and are suspicious that the vaccine, may be dangerous, that may be not high quality. And so what we found is that the people that are most trusted to give them information about the vaccine aren't necessarily experts. They're your neighbors. And so if you create these contact tracing, these public health workforces that can not only do contact tracing, but then also help you with vaccination, then you've got reach into the communities, and that's really what you need to get in on top of a pandemic. And so from a World Bank perspective, I would say, well, the World Bank has done so-called conditional cash transfer programs for a very long time, where you just, you give money to poor people and you tell them, in order to get your next tranche of money, you need to do these things. Well, you could craft it in something like a conditional cash transfer program, but the conditions would be that you'd be a public health worker. Right. And this is something that we've been working on in Haiti, in Rwanda, in some very, very poor countries. And they've been doing it. They've been doing, not only contact tracing, but now are going to be involved in vaccine distribution. They've been doing it very effectively. Now, there are a lot of good things about creating these public health worker programs. First of all, investing in a public health worker program, you have to think about it as investing in economic growth, right? When Srimaliani was with us at the World Bank Group, we created this thing called the Human Capital Index, and it was launched in Bali, and at our annual meeting, and at that annual meeting, we showed that investing in health and education is a really powerful way to drive economic growth. Now, I can't think of a more powerful driver of economic growth now than investing in a public health workforce that would help you get your pandemic under control, right? So I don't think it's too late to do it. I think it's important to get started as soon as possible. I think any money spent on supporting people from communities all over Indonesia in becoming those health workers who can not only help you with contact tracing, but do vaccinations, and then be part of an overall, Indonesian public health workforce, that in the future, if there's another pandemic, a different kind of virus, that they can be brought back into the fold. It's a great idea for epidemic control. It's a great idea for laying the foundation for future economic growth, because once your pandemic is under control, your economy can grow again. But the other thing is that because you put money directly into the hands of relatively poor people, it's also fiscal stimulus. It stimulates the economy, because what we know is when you put that money into the hands of poor people, they spend it, right? If you give tax cuts to rich people, they don't necessarily spend it, right? So it's epidemic control, it's unleashing the levers of economic growth, and it's also fiscal stimulus. And by the way, another really important aspect of creating programs like that is that it's very important for poverty alleviation.
Dr. Kim, yeah, I think one of the major aspects of COVID-19, especially on the economic or policy front, is really it was a wake-up call that globally we have underinvested in public health. But do you think developing economies, like Indonesia, would have the capacity, would have the political will to really focus on reassessing their public health and administration, say for the next 5 to 10 years? Because I think this is where you come in at, right? With the program at the World Bank and so on.
Well, so Gundy, you probably know from things I've said before, I'm a huge fan of the current president, President Jokowi. And my friends in the administration, Pak Luhut Panjaitan and Sri Mulyani, I think are some of the most effective leaders that I know in the developing world. They're some of the most effective leaders in the world. And so I was really impressed with the political will that was demonstrated and the actual execution around reducing childhood stunting. Right, but President Jokowi set a really difficult target, and frankly, COVID-19 is going to have a huge negative impact on reaching that goal. But still, I was very impressed with the progress that was made, and that's a difficult issue to tackle. So I have great faith that Indonesia can do something like this. And if Indonesia does not have the expertise on how to build community health worker programs that can tackle pandemics, we can certainly find it. I mean, there are great programs all over the world. I've been involved with many of them, and I'd be happy to help in terms of technical support. But I would just say, every country in the world is going to have to come to terms with this, because it's not, if we're extremely lucky and we get to 70 to 80% vaccination and it goes away, if we're extremely lucky, wonderful, right? Then what you would have done in trying to build this program is you would have given money to very poor people and taught them some skills in public health that will be will be useful if there's a future outbreak. But that's only if we're really lucky, right? If we're not so lucky, and if this virus follows the pattern of some other infections in the past, then what will happen is that we'll have to continue to fight this pandemic. And then public health will simply become part of our daily lives. And I think that's actually true. I think public health is going to be much more part of our daily lives for quite some time. I mean, when I said to people on interviews that I don't know that we're going to be able to put this pandemic down by the end of 2020. I mean, this was in March and April. I was saying this. they were saying, are you crazy? That would be, horrible. That would be horrific. And now what are we saying? We're saying we'll be lucky if this, if everything's normal by the winter, right? And there was some talk about, well, the summer could be great, right? But now you see Italy's being locked down. And Gundy, I'm telling you, is so predictable, right? It's so predictable because if you don't do testing, contact tracing, isolation, quarantine, treatment, if you don't do those things, there's no miracle out there. Vaccinating 20 or 30% of your people is not going to make anything go away, right? So this is what happened in these countries. Now, I understand what the policy makers are saying. They're saying, we just can't keep this in lockdown. We've got to get economic activity going again. But I think that's short-sighted. I mean, I think that we're going to have to say, okay, whatever it takes, we're going to have to build the public health workforce that can bring this under control. And then once we do that, we'll keep investing in it, and we'll work to try to find access to the vaccines we need, because this is going to be what our lives are going to look like. Right now, still, and I wish I didn't have to say this, but right now, still, there's just so much magical thinking that you sprinkle vaccine dust over everybody and this will go away. Gundy, it might, right? It would be great if we get to 60, 70% vaccination in the US and boom, it goes away. That would be great. But then we're only going to have 20% vaccination in Africa, and we know how fast this virus spreads. They're going to be mutant varieties, and those mutations very well could lead to variants that can infect people who are vaccinated. Once that happens, boom, we start all over again, right? In pandemics, you have to assume the worst case scenario, build your response based on the worst case scenario, and then celebrate if the worst case scenario doesn't happen.
Well, Dr. Kim, I have so many more questions to ask, but our time is really limited today. But I have one question for you.
Sure.
I mean, you talk a lot about all the different challenges among nations, the possibility of mutant variants of this COVID-19 pandemic. So in your best estimate, how many more years do we need to wait, for this pandemic to be over globally?
I don't know. And I think the only honest answer to that question is we don't know, because we've never had a challenge like vaccinating 7+ billion people. We've never had a challenge like that before. And now that we're looking at these new variants, the challenge may be to vaccinate, 8+ billion people, 7+ billion people over and over again, right? I don't think anyone can know. I mean, I think a lot of adjustments are being made, but I think life has changed fundamentally. I mean, some simple things. For example, we've done a ton of business over Zoom, just like we're doing this now over Zoom. I've done a lot of teaching over Zoom, and it's a pretty good experience. It's, if you want to have, guest lecturers, it's much easier to do that now. I think there will be less business travel. I still think, in-person meetings are going to be very important for starting relationships. But once you have a relationship, I think they can be maintained over Zoom in a very nice way. So I think some things are going to change. So I worry about things like the tourism industry. Right now, my hope, of course, is that it will come back. But I just think personal hygiene has changed forever. I mean, people now are talking about whether handshakes, are going to be gone, right? That no one is going to shake hands anymore. This is something that actually happened in East Asia, right? So mask wearing was very common in Korea, Japan, China for a long time. And a lot of that was because the experience with SARS. So, Gundy, again, the bottom line is anyone who tells you they know when this is going to be over, right? Be a little bit suspicious of that, because we really don't know. We don't know how strong these variant strains will be. We don't know yet whether we can keep up with vaccine production to be able to keep up with the variant strains. We don't know that yet. And until we know that, we can't say it's over. So in the meantime, you really need to put your public health system in place. And it could be in Indonesia that you don't need to spend that much money, that if you have that kind of system in place in the places where you have the most virus, you might do very, very well. But I mean, you're not going to get back to full economic activity until you have the pandemic under control. You're not going to get back to having lots of tourists until you get the pandemic under control in those tourist spots. You can, as I said, it's testing, it's contact tracing, isolation and quarantine treatment, and now it's strategic use of the vaccine so that you can open up parts of the economy that you're focused on. And to do all that, you can hire public health workers who otherwise would not have a job, right? And you'll teach them a skill, you'll stimulate the economy, and get Indonesia back on the path to growth. So anyway, I just want to send my condolences, as I do to every country, for having to suffer through such a terrible pandemic. And we just weren't prepared. But in every meeting you go to, in every discussion that you have to listen carefully and say, okay, how much of this is magical wishful thinking? And how much of this is saying we have to do the hard work of preparing for the worst possible outcomes, right? I think, unfortunately, in too many countries, we're still trapped in magical thinking.
Well, Dr. Kim, I really hope that we can welcome you again in Bali at some point. I don't know whether it is the next 1 year, the next 5 years, or the next 10 years. We'll never know. But thank you again for joining us. And if there is any last parting shot message that you would like to convey to the people of Indonesia, to our audience at Katadata today, I would really appreciate it.
I want to thank Katadata for having me on. I know it's your 9th birthday, and you're one of the exciting new tech startups. And so I wish you all the best on your birthday. And I just want to say to the people of Indonesia, you're in a good situation. I mean, the epidemic has been bad in Indonesia relative to other places, but think about the other parts of the world that have done so much worse. And so I would just simply say, get ready, get your forces ready, think about being more aggressive against the pandemic. I believe you have fantastic leaders who are running the country right now. And if you can get the pandemic under control, look around you. You can get your economy back up and running. You can have high rates of economic growth again if you get things under control. There are many of us who would be very happy to help. And for all the wonderful, gracious hospitality that you've shown me in the past, when I visited both as the World Bank Group president and in my current role, I just want to say terima kasih.
Dr. Kim, that was a great discussion with Dr. Kim Jim Yong, who is a globally well-known health expert. And that's all for our session today, and I will pass it back to the producer of the studio. Thank you.
Ya, bersama-sama telah kita saksikan diskusi sesi ketiga bersama Dr. Jim Yong Kim selaku Health Expert and President of the World Bank Group 2012 sampai 2019 yang disponsori oleh East Ventures, Bank DBS Indonesia, PT Barito Pacific Tbk, PT PLN Persero, Unilever Indonesia, GIZ, German International Cooperation, Link Aja, dan didukung oleh GoPlay, Oxford Business Group, serta para media partner, Media Group, Metro TV, Media Indonesia, Medcom.id, dailysocial.id, Berita 1, Tech in Asia, Kompas.com, dan juga Net. Jangan lupa setelah ini akan ada sesi diskusi keempat dengan tema The Collaborative Effort in Driving Sustainability Agenda bersama dengan 3 narasumber, Dr. Alin Halima Tusadia, selaku Head of Environmental Economics Research Group LPEM FEB UI, dan yang kedua Michael Larson selaku Chief Sustainability Officer of DBS Bank, dan yang ketiga Ahmad Rifki selaku Analis Eksekutif Senior Departemen Internasional OJK. Baik, kami akan segera kembali untuk Anda, jadi tetaplah bersama kami.